Okay, so today I've just finished my second OPD. Just wanted to share few things. The presently the scenario of increasing the pain and the lower back pain and the neck pain, it is increasing, and also frequently once you feel better, again also there will be recurrent. That why you will get this one once you'll feel better, again why you will get suppose after 3 months or 6 months again you will get the similar pains on your neck and your lower back. See the exact cause is I think what happens once you recover it, you need to strengthen that thing. Suppose what happens in common things, how you will get a pain. This is your bone. The in between two bones there is a sponge-like structure issue like this, that's called intervertebral disc. So when you bend it to one side, this will get compressed. So once it becomes normal, it becomes straight. So suppose in between the pain behind this get compressed like this. So then what will happen to next? So you'll get pain. So once the pain will get relieved after a treatment, what happens? This will again come back to normal position. But what maximum they do the mistake, they will immediately start doing their regular routine work and bedding, driving, all that things will come on household work, everything will start doing. Because who holds this one? The muscular structure. So you forget to strengthen that area. That is again you get recurrent pain. So once you feel better, suppose even also you want to take the routine MRI, MRI shows completely normal, there is no compression at all, so everything is fine. So then you need to go for a muscular strengthening exercise particular for your back. So that will hold completely straight your spine. That does not allow again to go for the further compression. So that is keeps on maintaining for a durations, take as a minimum average of 3 months. Then you will feel yes, I can do it now. I can bend it front. Because I have seen maximum patient what they do it. They once they feel better, they start doing all kind of yoga asanas, so bending, all that front, back, side, all that kind of doing. So again, that will obviously that will be recurrent. So to not to get any recurrent, it's not only once you've taken the medication you feel better, okay, stop it, go over it. That's not end. In this you need to maintain it, not to get it again. Yeah, everything is not in your hand, but this is something we call is a mechanical injury. So when you have the injury, you will trauma something that's continuous stress injury, then you will get it. So you have to do your regular work, so you can sit ideal at home by taking rest. So you have to do regular strengthening exercise. Top of that, again the flexibility exercise. Then after that, do for continuous 2 to 3 months. Then you start doing your bending and all kind of yoga sana. You will do that is fine. But till that, at least for a 3 months period of you will continue the strengthening and flexibility exercise. Then the chance of getting recurrent is very less. So that's always don't ignore once it feel better. Maximum during the treatment, then stop medication. I was feeling better, I was fine. Then why I should take medications? That's not the scenario. So doctor treat you to get relief. And second part is at least not to get it again. Yeah. 100% nobody can give you the guarantee. Even also being a doctor, we cannot take guarantee on ourselves. So that is, of course, sure. Nobody can. At least we can try to prevent it. Not 100%, at least 80%, 90%. So that is it. Maximum you can avoid it. So that's the only one things because this is very common nowadays in trending. And yeah, finally, never forget to maintain your vitamin D and B12 levels. So obviously, maintain that two vitamin D and B12 on normal levels. That is obviously it will be not to have it because back pain and neck pain is become common scenario. Apart from the neck pain, you will have the multiple issues. You'll have the you'll have the headache, you'll have the migraine, and so this giddiness. You'll have the something burning pain on eyes. Sometimes you'll get the ringing sound on your ear. You'll get reference on your hand. Sometimes this one will refer to your shoulder, this one shoulder and chest, and then again you'll have the some difficulty in lifting or moving anything. So that will become common things. Multiple issues will have the problem in this one from your the cervical regions and the neck regions. And the diagnosis also is not easy for every doctor. You will refer to from your left side, you will go to this one left side of chest, then you will run towards a cardiologist. The cardiologist do all the kind of test or ECG and the echo and or this one TMT or after doing everything is fine. Okay, you go back, but your pain doesn't come down, subside. So that we should keep in mind obviously this one from the neck to the multi even 90% of the headache will come to the symptom this one that also come your cervical spondylitis that is only the neck the spine and the neck regions. So the you will take care of your neck even also you can avoid getting headache also. Only the neck problem will have the you will have the your disc is getting compression neck region that does not mean that only will give the neck pain. If the patient will come back, they will start arguing. One says, no, sir, I never had an issue of the pain on the neck. So it's not like that you will have the pain on the neck, only one scenario. You will have the multiple complications will arise from your neck. So make sure your doctor is advising what is advising, just follow to that to make you better, to feel you better. Okay, so take care and do regular up a little bit. Do this one morning walk, how much is possible. Maintain your vitamin D and B12. So next time, this one I'll talk more about this spine and the brain, which is combined together. What kind of issue, regular issues, will have it is, and how you can avoid also. So few tips I can share with you. So that is about the combination of this one, your brain and the spine, which is this kind of problem will give it is. Which if leave it is even also sometimes become very complicated, it will go out of the hand to treat also. It's okay. So thank you. So see you on next time.